But if you have people that are coming from all these different backgrounds and experiences, you're much more likely to have broad differentials and a robust problem solving environment. And I feel like there's lots of studies out there that just show that diverse groups tend to do better in terms of problem solving and success. So I don't know why in this country we keep shooting ourselves in the foot trying to fight against diversity when in fact it's really what makes this country so great. I feel like our country's special superpower is the diversity, and remain hopeful that we'll have an amazing generation of physicians coming up like you who value this, but we have to keep fighting because I think it's the best way to deliver medical care.
Welcome, everyone. My name is Dr. Moss at MedPsych Moss, and you are listening to Life as a Patient Doctor. Today, I have an amazing guest, Dr. Amanda Adeleye, who is a reproductive endocrinologist and infertility specialist. She's the founding partner and medical director of CCRM Chicago. She's passionate about increasing health equity in the fertility space. Her research has centered on patient education and disparities in infertility care. She's the chair-elect for the Access to Care Special Interest Group of the American Society of Reproductive Medicine. She has been featured on NPR and interviewed for the New York Times, National Geographic, and more. Thank you so much for being here today.
Thanks for having me, and thanks for that kind introduction. And also, I have to say a special congrats to you on graduating from medical school, Dr. Moss.
Thank you. Long journey, but I'm glad to finally be here.
Yes, that's amazing.
I would just love to hear a little bit more about your journey and background into medicine.
I'm from Illinois, currently based in Illinois. I've always loved math and science. As a kid, I remember being particularly interested in biology and was acutely aware, even at a young age, of some healthcare disparities that I found to be upsetting and interesting, particularly around like the HIV/AIDS epidemic. I was a kid in the 90s, so I remember starting to see how disparate outcomes could be, and that always bothered me, and I put that in my back pocket. I also really liked cardiology back in the day, and I just really loved understanding how things work in the body. I went to a math and science magnet school for high school, and I had the opportunity to do research. And that really gave me the academic research bug. Even going into college, I wasn't sure if I was going to be a PhD in the biologies or be a physician. And ultimately, through college, I decided although I love research, I didn't want to be stuck writing grants the rest of my life. I really get fulfillment from helping others on a more day-to-day basis. And so that let me know I think medicine was probably going to be a better fit for me. Then I applied for medical school, got in. I went to Columbia for medical school, and that was a challenging and great experience. That would probably be my short to medium length answer about how I got into medicine.
I love that. So such a similar path that a lot of us have is liking some sort of math and science. And then really, I like that you said that you were really debating between MD, PhD, because I see that as a common theme. I was even in psychology. I was like, do I do my PhD in psychology? Do I do my MD psychiatry? I don't know. I definitely relate to that concept. You were interested in cardiology. That's a bit different than reproductive endocrinology. What kind of led you down that path?
Yeah, I think the thread in all of it is just I like learning how things work. And that's in so many different medical fields. I think as I went through puberty and became a young woman, you start to see some of the disparities that women face or women identified people in terms of access to opportunities and education, both globally and within the US. And I didn't like that disparity that I saw. And I think it made me feel like I wanted to impact women positively. That's what put me in the direction of women's health. Some of the research that I did in college was in breast cancer. Basically, I just applied for the summer research program as an undergrad. It was called the CURE program at Northwestern. It's a cancer umbrella research and education program, which was phenomenal. And I really enjoyed it. I did it either 1 or 2 years. I did it because I was interested in medicine and research, but it happened to be in cancer. I happened to be put in a breast cancer lab with Dr. Vince Krenz, who used to be at Northwestern, is now at the University of Wisconsin, and was one of many pivotal people in my life in terms of really inspiring me. I had the bug for women's health. I spent probably 5 to 7 years between college and med school trying to figure out, did I want to be a breast surgeon or did I want to do OBGYN? I think I knew fairly early on that women's health was going to be my jam, but exactly how I was going to do that, it took time. In medical school, once I learned more about what the field of OBGYN was like, I loved operating. I was like, oh my gosh, you get to wear pajamas to work, listen to music, hang out with your friends, and use your hands. I was like, this is like a no-brainer. I actually skipped my REI day in med school so that I could go deliver more babies because I like delivering babies. I felt like everything was pretty like rosy. And it wasn't until I actually got to residency that I had a big change of heart. My second day of being a resident, they put me on labor and delivery days. I was with my chief resident, Dr. Lisa Grossman, who's amazing. The first day was whirlwind. I think it was a Wednesday. I'm not positive, but I think it was a Wednesday. It was just busy. The second day, we're like into the second delivery, and I was like, I don't think I'd like delivering babies. That was a very scary moment because I had just signed up to do this for 4 years. So I was like, I need to really figure out what I like doing. And to be clear, a good vaginal delivery is one of the highest of highs. I do like delivering babies and enjoy taking care of people in that part of their life, but there's a lot that goes into it. The electronic fetal heart rate monitoring, the litigiousness, and the documentation. I didn't enjoy that. And I was like, I didn't want that to be the majority of what I was doing, even if there were like these highs of highs with delivering a baby. So I was like, I need to find something else. And so then it really got recentered on, hey, ever since I was a kid, I really love science. I love technology. I love using my hands, and reproductive endocrinology and infertility really hones in on a lot of the things I've liked throughout my life.
I see that progression, especially in the endocrine infertility. There's a lot of science, a lot of research. That's really interesting. I think it's also really interesting to note that just early on in the residency, you were able to note what your passions are and what not your passions are, and that you were able to still maneuver, and it wasn't hard set as maybe we like to think of it in medical school.
I hope it's a lesson or a boost for other people. On the one hand, it was very scary, and I felt very silly that I had committed several years of my life to do something that I was like, oh, I don't think I like it. But the reason I went into it was because of the overall theme of women's health. I believed very strongly I could maneuver within the field and find what I liked. Not great not to love labor and delivery, because it is a lot of what you do as an OBGYN. But it was okay because the foundation was using your mind to help half of the global population, and arguably more in some regards. So it was okay. It's okay to realize and pivot as an adult. It can be scary, but it can be really rewarding.
Thank you for sharing that, because that is something that I advocate for a lot, is that idea that everyone's path isn't linear, and especially medicine, there's so many paths, ups and downs, and ways that we don't even realize until we're there. I'm interested, what challenges did you encounter on your medical educational journey?
I'm not sure that there's anything profound or unique. I'm certainly not the smartest person out there. I work hard, I know things, but I'm no genius. I had to really spend a lot of time studying. I didn't always get things right. I guess I was fortunate that I really like to be challenged. I like to be pushed to my limit. And so like I went to pretty competitive high school and pretty competitive college. I didn't do it looking for an easy way into a great next step. I did it because I like to be challenged. Even in medical school, I'd be challenged, but I enjoyed it. So it's a little hard for me to answer. Academically speaking, yes, things were hard, but it's okay because I was already pretty comfortable with being challenged. If I have to think back, it's been a while since I was in medical school, but I think the whole lack of clarity around what that next step is going to be, the ambiguity, I think that was really hard to sit with. Like when you're first or second year medical student, it's okay. Like you're learning the ropes. Columbia was pass fail, and I made some of the most amazing friendships in my life. I'm so grateful for that time. But then it gets to be like your third year, your primary clinical year. And I do remember feeling like every note you write, every step you take, every move you make, am I going home too early? Am I coming in too late? Am I doing anything wrong? And so like that kind of constant worry that every move you make is going to influence your grade, which is going to influence how you match, if you match, which is going to influence where you go. And you're also trying to be a human and a person and maybe meeting somebody and relationships and all these things. And so I do think that there's a level of kind of constant anxiety as a medical student that I don't have now, right? I have a job that I want. Nobody else is looking at me and examining and trying to make a decision about what I get to do next. So I am the person in charge of my life. And I think medical school and also residency are really hard because you don't have as much control, especially compared to age matched peers. So it's not good to have control taken away in general, but then also to see your friends in other fields who are like, yeah, I'm going on vacation, I'm doing X, Y, and Z. And you're like, I'm afraid I don't get here at 5 o'clock on the dot and I don't write this amazing note that is exactly what my intern resident wants me to write. I may get a pass and not like an honors or whatever. Those would be a couple of the challenges.
Thank you for sharing that. I'm hearing a lot of that limited autonomy and kind of struggle with that, the culture of medical education being solely focused on grades or honors. And I really like that you said that you made it. You don't have to be fully stressed about being constantly judged. How have you managed being able to balance now that you have full autonomy? How have you worked to balance your work life? How does that impact selecting your new career? I heard something about maybe having a new work.
I think it's hard to find a balance. I know people that do have a really good work-life balance, but you trade one problem for another. I think attending life, it's nice in that you have more autonomy, but you have more responsibility and you're not totally autonomous. I think something I've struggled with throughout is the way we practice medicine. I don't know that there's any country that administers medicine in an ideal scenario, but I do think in the US, given that we don't have a nationalized healthcare system and that there are so many ancillary players, payers, administrative staff. We spend a lot of money on a lot of exogenous things that take away from the physician patient relationship. And it's something that continues to bother me. And I'm saying that because maybe you get to decide where you work, but where you work, they're going to be concerned about your productivity. How many RVUs are you generating? They might still dictate which patients you can see based on their insurance coverage. In prior employment, I wasn't always able to see patients with Medicaid. That might still continue to be the case because reimbursements are maybe not what they should be, or really they're absent when it comes to infertility. You gain autonomy, there are going to be other challenges professionally speaking. And I don't think it's a matter of moving through your field, going from med student to resident, resident to fellow, or resident to attending. I think it's just aging in general. As I approach 40, it gives me more insight into, in my view, you live once, and speaking up more about what are the things that are going to work for me and my family, and really making sure you understand your value. They're not a ton of physicians. So you just are living the journey now. It's hard to become a physician. And if somebody as an organization isn't going to treat you well, you can take your services somewhere else. I think being empowered to feel like I can make decisions. They may not be easy. It might still have other things I have to think about and complications, but these things can be done. And it's a part of the journey in life. There are going to be ups and downs.
Thank you for sharing that and how to go about these systemic health challenges that pretty much wherever you're going to work, there's always administrative, political factors impacting just wanting to be with a patient and be human with each other. You mentioned that balance with managing relationships and family. Are there any suggestions or advice that has helped you when navigating those relationships while being in a very busy specialty?
I mean, I think if you're interested in being in a relationship, finding the right partner. I feel like I'm speaking to the choir, people who are listening, duh, why would you want to find somebody who's not the right match for you? I met my husband when I was in med school. He was not in medicine at all. He was just a very chill and supportive and kind person. At that time in my life, I was pretty picky. I felt like I was living in New York City in my 20s. Life is good. I don't need anybody. I don't need a support system. I was very happy to go through the rest of my life single. I think that was a great place to be because I didn't look for or seek somebody to validate me in some way, right? But this awesome person who's now my husband was just a total bonus and brought so much light, levity, and joy. Things can get really hard and dark when you are in medicine, and particularly a resident, when there's a really high concentration and intensity of sick people. I think if you are the kind of person who wants to have a partner, be picky. It's okay. You don't have to be with someone. And quite frankly, there are going to be things that are easier when you don't have a partner. If you do want one, great. If you don't, that's also great. If you're thinking about family building, it's hard to do no matter when you decide to do it. I've always heard that, and I think it's true. I did wait until I was almost done with fellowship, so later than average in the US, but probably fairly average for physicians. I was 30, 31. What? I don't know how old I was. I don't know. I have to think about it. Maybe 31, 2, 3, 4, whatever. Early 30s when I had my first kid. And yeah, it was hard. It's still hard. And now what I tell people is if you do decide you want to have a family, it costs a lot of money. I throw all my resources into childcare because I want my kids to feel loved and safe. So I pour a lot of money into that, a lot of money into date nights. We have standing babysitters to make sure me and my husband can still go out. And that's really important so that we can stay connected when things are very busy, and just know you're going to be tired and exhausted. But again, you only have one life. So then I think you can decide if it's valuable to you, if it brings you meaning, it's rewarding and tiring. And I'm still working to find a balance. I don't know if I have it yet.
Thank you so much. You provided so many helpful tips, I think, for both people who aren't in relationship and are. I know my husband and I were both in medicine, and it's still hard. And we don't have kids. I want to say that we don't have kids, and it's already hard to schedule date nights or doing stuff that's not medicine together. Sometimes I am jealous of the people who don't have a medicine partner, because then you can actually disconnect from medicine. Thank you for sharing that experience of what it's like to be with a non-medical partner. It's important to show the variety of what it looks like with a partner in medicine, what it looks like without a partner, what it looks like just being a doctor and a human without anyone. That was very validating to hear. You don't need a partner and you can be picky, and that's okay. You can choose your own needs and your own path. That is so important. I know how difficult it can be being a Latina myself, and also being in a marginalized identity going into especially like surgery, where there are less people that are in underrepresented medicine. I would love to hear if you're comfortable a little bit of the challenges or advice you would give to individuals dealing with differences in race or gender. How have you navigated, or do you have any suggestions?
I think having a good support system of other people who may experience what you do. Because I'm an OBGYN and currently it tends to recruit more women than men. I hope that changes. I have a good cohort of dear friends who are also OBGYNs and identify as female. And that's important when you're experiencing, misogyny in the workplace. I can text my friends and just be like, oh my gosh, you won't believe what happened. It feels good to have people say, hey, I've been there too. Of course, you don't want your friends to have your bad experience, and that's not what I mean at all. It can be really affirming and validating when you have a negative experience to make sure it's not just you, because I think the world would like to make you feel like you're the crazy one. You're the one who's being overly sensitive. You're the one who's looking for problems where there are none. And that's not true. There are true problems. There's real misogyny and real racism that we experience as providers, colleagues, employees, somewhere in the hierarchy in medicine. It can be really lonely if you don't have somebody to talk to about it. So I think number one, having those groups. So like I said, I have lots of female friends that are physicians, and we've vented in various ways about the misogyny that we've seen in the workplace. And then also, I've always been somebody who likes to reach out to other people of color, particularly Black people, just because in this country, I think that people of color, particularly Black people, have a very unique experience, as do Latinx people, as do Asian people. But I think they're all a little bit different. At Columbia, they have the Black Latino student organization, which was great in college and medical school. And since then, I always try to be involved in some minority medical related group, or make sure I'm networked with other minoritized physicians. There's an Instagram group of Black, female, or just Black doctors, but they're all female right now anyway. And we all still talk about things. And again, there's something about like when you have a bad day and somebody's been, disrespectful towards you, or you feel like you don't know how to make your next move. I don't have all the answers. I'm still trying to figure things out. But man, it's really nice when you can talk to somebody else and say, hey, this is what happened to me. What would you do? I think my biggest advice would be to find a good support system. And you can start off by just saying hello. If you don't know how to do it, if you didn't do any of the identity group clubs or something in college or med schools, that's okay. make today the day. You say, you know what, I'm going to go, I see this person across the hall. I think that we might have some similarities. I'm just going to say hi while they're getting coffee. That is a good place to start.
Yes, that is such an important thing. Learning how to just suck away any insecurity and just say hello. So many friendships have been built that way for me, of being able to notice something. Oh, that is similar. Or maybe let's just try it. Maybe they'll ignore me. Maybe I'll never talk to them again, but just trying it. I also really like that you said of how meaningful it is to find a support system because it helps you feel not alone. I talk about that a lot on my podcast and on social media. This concept of whenever we're failing an exam or not doing well mentally or physically, we like to think that we're the only ones. And that's a very human concept, is think that it's only me that can struggle, only I can be in pain or challenge. And the thing is, if everyone thinks that, it's so important to break away from that, and sharing stories can be really helpful, because you can realize we all as humans share a lot of commonalities, emotions, or experiences in different ways that can help us connect. I know we talked about it, but I'm interested in getting your thoughts on breaking stereotypes and promoting diversity and humanism in medicine.
Yeah, I think it's very important to break stereotypes in medicine. I think diversity is incredibly important in medicine. Some stereotypes are being addressed. The majority of women are enrolled in medical school. I think there's still issues around leadership of women in the medical environment. But I do think in the US, I would say, if I think about how I envisioned a doctor when I was a kid versus as a physician now, I do think we've made some good strides in terms of gender parity and representation, but that doesn't include transgender, gender expansive, and non-binary folks who maybe are not reflected as well as they should be in medicine and medical leadership. I don't want to exclude that group, but talking about cisgender women, I do think there have been some improvements, but we have a long way to go. Diversity is incredibly important, and it's unfortunate that I think after George Floyd was murdered, there's all this excitement around diversity. I've been a minority all my life, as have you, and you get to a point where you're like, okay, let's see how long this lasts. It was about 2 to 3 years. And a lot of things are rolling back. Well, it's disappointing. It's not surprising. And I think, unfortunately, the concern that people voices around being in medicine, as in with many other things, it's a meritocracy, and diversity takes away from the merit in all of this. And there's so many reasons why that's not true. But something that doesn't come up as often is that diversity in your medical group, whether that's within a group of physicians or health providers, or including your staff and nurses and MAs, the diversity is helpful because you can get a diversity of thought. It's not just about how you look to your patients. It's about diversity of thought, right? If you see a sick patient in your office and everybody looks the same way, trained the same way, thinks the same way, you're going to miss that red herring. It's going to get missed. But if you have people that are coming from all these different backgrounds and experiences, you're much more likely to have broad differentials and a robust problem-solving environment. And I feel like there's lots of studies out there that show that diverse groups tend to do better in terms of problem solving and success. So I don't know why in this country we keep shooting ourselves in the foot trying to fight against diversity, when in fact it's really what makes this country so great. I feel like our country's special superpower is the diversity, and remain hopeful that we'll have an amazing generation of physicians coming up like you who value this. But we have to keep fighting, because I think it's the best way to deliver medical care.
I love that. Especially, you mentioned something I hadn't heard of, but it is so important, is just looking at your patient population. Who are the people that you're seeing? If they all look the same, I can see how people can get stuck in certain ways. And then that's how maybe people that go to providers and they miss things, it could be a contributory part. I'm glad you mentioned how important it is for us as healthcare providers to make sure we have a diverse patient population, to see different things, to treat different things, so we're not just stuck in one way. I would love to hear how you feel it is helpful to connect with other patients who maybe look like you or have similar characteristics when it's something physical like race, It's probably easier to see, but especially in the infertility world, do you ever share with your patients that you have kids, or is that kind of touchy? I remember when I did IVF and I was still in the mindset of, oh my God, I'm going to be infertile. I'm never going to have kids. If my provider said it, maybe it would have helped, maybe not. How do you manage that?
Yeah, it's a challenge. I do not mention that I have kids, and I'm pretty intentional about that. It was definitely hard to be pregnant and be an REI, and that's like a whole nother story. That's hard, but I fully recognize that my patients are often bending over backwards and turning themselves into pretzels trying to have a baby. For me to be like, oh, my kids do da 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 da. It's not the place. It's not about me. And the only time I would bring it up is sometimes I had a short cervix with my first pregnancy. It was really bad and I had to get like a rescue cerclage. And then it was an issue with my other pregnancies, but it's fine. I got a cerclage. If I have patients that have had a history of a short cervix and pregnancy loss and things like that, once in a blue moon, I have said, oh, I had a cerclage and it was fine. And so I really encourage you to talk to a maternal fetal medicine specialist about your history so that you can make a plan about whether or not you need a cerclage. That's probably one of the only times bring up my personal life, but otherwise I miss it. I love my kids. I love that part of my life. It does feel a little bit weird not to talk about it, but that has always been my policy is I don't bring it up because I feel like my patients often are really going through such a hard time. There's a lot of stress and depression in people with infertility. And the last thing you want to do is remind them of something that they don't have. So I try not to bring it up. And otherwise, I always love connecting with patients. And for, I think, your viewership, something I'm sure you've emphasized before is I think, again, diversity is so important, like not just diversity in terms of how we look, but our experiences. I was a classics major in undergrad. I was an NFL cheerleader, did all sorts of other weird stuff. I love reality TV. I just enjoy people. And I do try to connect with my patients if we have time. Clinics are not always that long, especially as you're building relationships with them. Maybe you're seeing them for their ultrasounds and whatever makes them happy. I always find, especially during feeling sonograms, so that's where you have a patient in lithotomy, you put in a speculum, and you put in a little tiny tube through the cervix into the uterus, and you put in salt water. It's uncomfortable, crampy, painful. You pick the word. I learned this from my attendings and just watching them over the years. Like talking to your patients through it and distracting them a little bit can be really helpful. But everybody's different. It's so fun. Honestly, I'm always coming up with random things like, which on TV, where are you going on vacation? What do you like to do? Do you like to go to Turks and Caicos? Do you like hiking? Living your own life and bringing other things that bring you joy into it and being curious about them helps to build a really good relationship with patients. I adore my patients. They're the reason why I come in and do what I do because I don't like documenting. I don't like billing. I don't like any of the other stuff, but I do love my patients. And yeah, so I think bringing your own uniqueness and joy and the things that make you happy into your practice every day is going to take you far.
Beautiful. Thank you so much. That was a really helpful viewpoint because that's something we've talked about before with a lot of different people. When we're considering disclosing, will it be helpful? Will it not be helpful? It's really helpful to hear you being very intentional with whether or not to disclose. And intentional means for you not to disclose for these situations. And you've pre-thought about it. You've developed a strategy for yourself. And I think that's something I just want to emphasize. I know that because I've disclosed a lot of things online about my experience, people think, oh, you just share with all your patients. I'm like, no, that's not the case. I'm trying to show that there's ways to do it and there's ways not to do it. You provided a helpful way to think about and why it wouldn't be helpful for this situation, but would be in this and how much and how little.
Mm-hmm.
Thank you so much for sharing that. As we wrap up, you gave so much amazing advice, but do you have any final words of wisdom to pass on to individuals, maybe other health professionals who live with disabilities or health conditions?
I think that there's two quotes I think about, and I'm not good with quotes, but the concepts are there. One is from Arundhati Roy, and the quote goes something to the effect of to love, to be loved, to never, to remember your own insignificance, to never make simple what is complicated or complicate what is simple, to seek beauty to its lair, and to never forget the cruelties in the world, and basically to just never forget. Basically, the point or the thing that I always take away from it is to never complicate what is simple or make simple what's complicated. And I think sometimes we all feel like you might compare yourself to somebody else and you might be like, gosh, they're able to do X, Y, and Z, and here I am not doing this. But we are all so complicated, right? Some things are simple. Don't make simple things hard. Also, don't judge a book by its cover. Recognize that every single person on this planet, including ourselves, are going to have some really amazing experiences and some real challenges. And that's okay. It means that we're not all going to get to the same place at the same time or ever. And that's okay. It's more about the journey. I think about that quote no less than once a day, and it applies to everything, especially as things are challenging globally. The other one is basically, it's very important to bear witness, to be able to tell your story. I'm a huge believer in narrative medicine and the importance of sharing stories. Personally, I don't always share my story. I'm more curious about others, as are you, since you're doing all of these podcasts. But I think sometimes it might be that it needs to be about you and you telling your story and looking for people to listen and building that support system, no matter whether you're going to be in healthcare or pivot and do something else. I think really knowing yourself and finding that good support system will take you.
I love that. Thank you, Dr. Adelaide. That was beautiful. The bearing witness is so important. I'm sure you do that a lot when working with patients who are coming to you with very vulnerable and difficult stories. Thank you so much for sharing that. I like that quote of never make simple that is complicated. It seems very relevant. As you learn so much, you realize that you still don't know anything, which seems counterintuitive.
The more you know you don't know, and get comfortable with not knowing. It's a very good place to be. If you assume you just don't know things, it makes life a lot easier.
Thank you. I will do a quick summary of all the amazing things that you mentioned. You talked about how you started off in the 90s where there was a lot of health disparities that you noticed, whether that during the AIDS crisis, and that definitely was something that really got your passion and really wanting to support others. In pre-med, you did breast cancer research and saw how important it can be to really support individuals with breast cancer. You went through like a PhD versus MD track, ended up choosing MD because you want to make relationships and really foster relationships with patients, not just write grants. Once you ended up choosing an OB-GYN when you were in residency, just in the first couple of days, you noticed that the typical OB-GYN of just delivering babies wasn't your complete passion, and that was okay. And you told us how important it is to be gentle with yourself and be okay with pivoting. You ended up pivoting to REI, reproductive and endocrine. Throughout residency and fellowship, you ended up having your children. You mentioned how important it was to have your group of people and support system, whether if that was your partner, your friends, your colleagues, just having a support system to when things were challenging at work or in life, you could connect on similarities or challenges, and how meaningful that was to be able to keep going. You also talked about disclosure in medicine and how you navigate and think about when it's appropriate or not appropriate to disclose to patients regarding your own health challenges, specifically when talking about reproduction. You've had children, and even though you've had complicated pregnancies and challenges, you were really helpful, I think, of discussing the pros and cons, your thought process. And lastly, you gave us some wonderful advice of how important it is to remember that we are also complicated and we can't just see someone and understand everything. Everyone's going to be so different. And that's why it's so important to be there as humans, as people. Maybe you do that through talking with patients about their passions while they're going through a difficult procedure. Or maybe that's just listening to other stories of other healthcare providers, like the power in narrative medicine. Being able to recognize that everyone has their own journey, and that's what makes us humans. We're not all the same. We're not all simple. I appreciate you being here. And if individuals want to contact you or follow you, how can they do that? I know you
Yeah,
mentioned the
sure.
Women Black Doctors group.
Yeah, if you want to follow me, I'm not really big on social media, but I believe my Instagram handle is like Amanda.j.Adeleye_MD. I think that's it. I'm probably the only one. So that's what you can DM me. I'm not on Facebook, not on Twitter. I think I'm on dexamethasone. So those are probably good ways to reach out to me. Otherwise, I'm hoping my new practice will be open next year.
I'm very excited to hear it. Maybe I'll be a future patient in post-fellowship in 4 or 5 years once I bring back my embryos
Yeah.
that are currently frozen. I want to thank everyone for listening in, and I always like to finish off by reminding everyone that they're not alone in their journey. And I hope that these stories have inspired you to remember that if you are dealing with challenges or health conditions, you're not alone. It doesn't have to be the end of your story. It's just a chapter of it. So thank you everyone so much. If you like to hear more of my story or other stories from health professionals, make sure you're subscribed to Life as a Patient Doctor on YouTube or where you get your podcasts. You can also read more about different journeys and stories about my medical school at medpsychmos.com. We're talking about infertility and REI, so you can see suggestions I have if you're looking to do your own fertility during medical school. Fertility planning, that's what it's called. You can check that out. And if you're going through the IVF process, you can read about my journey with endometriosis. Thank you, everyone. Social media is at medpsychmos. Thank you, everyone. Take care.